Welcome to our diabetes programs at Sentara Norfolk General Hospital and Eastern Virginia Medical School. Some of the challenges we have in our region include diabetes and obesity. In particular, if we look at the Western Tidewater region, about 18% of adults have diabetes, and is about twice the national average rate of about 9%. Our diabetes programs provide state-of-the-art care of diabetes and its complications, and they also participate in the education and training of students, residents, fellows, and practicing physicians. And in addition, they also participate in the research related to diabetes and its complications in all its aspects.
Eastern Virginia Medical School serves a population of approximately 1.7 million in southeastern Virginia. It's a health sciences university, and we train approximately 800 health professionals, 600 medical students, and 360 residents and fellows, and have a strong relationship with Sentara to meet our academic and clinical missions.
We're proud to say that Sentara Norfolk General is among the top 35 hospitals in the nation, as noted by U.S. News and World Report, with regard to both cardiovascular disease and diabetic and metabolic disorders.
Eastern Virginia Medical School and Sentara Cardiovascular Diabetes Program is one of the signature programs which brought together Sentara Norfolk General Hospital and EVMS. One of the rationales for establishing this unique program was the fact that diabetes prevalence is very high in the cardiovascular diabetes population.
The Cardiovascular Diabetes Program here at the Norfolk General Sentara Heart Hospital campus was created in collaboration with Eastern Virginia Medical School. And the reason why we created it is because we began to see an emergence of patients being admitted to our hospital for cardiac surgery who had diabetes and did not even know they were diabetics.
In our Sentara-EVMS cardiovascular diabetes program, there are 5 main components. The first is our inpatient consult service, our multidisciplinary work group that meets monthly, our use of technology, our post-discharge clinic, and the use of our outcomes data to help with quality improvement. In our inpatient consult service, we use an electronic algorithm to help to change our insulin doses and to help manage glucose control while in the hospital.
Approximately 5 years ago, we started a program for a multidisciplinary clinic for cardiac surgery and diabetes in the post-op clinic. After the visit is concluded, we give them a book. It's a cookbook that gives them good recipes that are heart healthy as well as diabetic healthy. We will see them again in the post-op clinic if we feel like we need to. Otherwise, we send them back to their primary care physician or their endocrinologist for further evaluation of their diabetes for management and treatment.
So for the past 20 years or so, we've been collecting information about the patients who undergo bypass surgery and other cardiac procedures here at Sentara Norfolk General Hospital, and to do outcomes research. Outcomes research is a study where we looked at 11,590 patients who underwent bypass surgery. About 43% of those patients had diabetes. What we found is the diabetes patients did not have an increased incidence of mortality or in-hospital post-operative events, which is very reassuring.
In terms of outcomes, it has been about 4 or 5 years since we established the cardiovascular diabetes program. We are able to show occurrence of low blood sugars or hypoglycemia has dropped by more than 50% since we established the program. The Strelitz Diabetes Center at Eastern Virginia Medical School was established in 1987. It serves as the referral center for patients coming from the southeastern part of Virginia for the care of diabetes and also for patient education. In addition, the Strelitz Diabetes Center also serves as the center of education, not only for students, but also for residents, fellows, and practicing physicians. Last but not least, the Strelitz Diabetes Center is also big on research, both in the basic research arena and also in the clinical research related to diabetes and its complications.
At the Strelitz Diabetes Center at EVMS, we use cutting-edge technology, including insulin pump therapy, as well as the latest in continuous glucose monitoring. We use the latest medicines available for treating diabetes, including those that have recently been shown to reduce the risk for heart disease development, as well as improving kidney disease in people with diabetes. One of our greatest focuses at EVMS is on patient education. We are proud to have an education program that has been recognized by the American Diabetes Association for excellence.
So in terms of research, the Strelitz Diabetes Center for decades has been doing research in all areas of diabetes, including basic, translational, and clinical research. I would like to highlight two areas of research. The first one is my team is working on diabetes medications and cardiovascular outcomes. Over the last few years, the diabetes world has been in excitement because two groups of medications that we use for management of diabetes has been shown to improve cardiovascular outcomes, which includes heart attacks, stroke, heart failure, and kidney disease. So we are doing studies which focus on those medications and their effect on heart failure on one side, but also their effect on cardiovascular outcomes in patients with obesity. The second area of research I would like to highlight is our research on diabetic neuropathy. With the leadership of Dr. Aaron Venick, who is a global authority on diabetic neuropathy, some of the results of those studies have led to medications which have significantly improved pain and quality of life in patients with diabetic neuropathy.
Us, the basic researchers involved in diabetes research, are working with surgeons at the Bariatric Center at Sentara Hospital, and also with clinicians at Strelitz Diabetes Center. And we try to investigate how meta-inflammation in adipose tissue of subjects with obesity and type 2 diabetes impact on comorbidities such as cardiovascular disease or cancers.
Here at Sentara and Eastern Virginia Medical School, we'll continue to work hard to ease the suffering of our patients with diabetes, and we'll continue to work hard to discover newer and better ways of managing their diabetes and its complications in Virginia and beyond.